So this is the module on coronal polishing. First, you'll need your handpiece. This is the young handpiece. You'll get a second one in your winter kit. You'll also need the Profi cup. So you just open that up. You take it out and you put it on the handpiece. Now you can see on the handpiece there's a little notch there, and then there's also a notch in the Profi cup. So you'll line those two up and push. It takes a little bit of effort to get that in there. You'll also need to have your Profi paste. So you'll just tear the top off that. Now, of course, I don't have this attached to anything right now, but it will be attached. If you see here, there's a large and a small tube, and you'll just need to line that up with your tubing on your tray. You'll just push that in, and then it screws right in there. So now you're going to use a modified pen grasp, and it's okay if your V in your hand supports the handpiece. So you will gently stir up the Profi paste and fill your cup up. With about that much to start. Now, before you actually start, you're going to determine if there's going to be any extra precautions that you need to take. And then we'll identify whatever surfaces we're going to polish. And we'll make sure we tell the patient what we're doing. We're going to be using the same sequence that we did for probing. So we'll actually start on number 1 over here, buccal, lingual, and then we'll move down here, mandibular, buccal, and then lingual. So it's the same sequencing. For instructional and video purposes, am going to start over here so that you can see. We're going to establish a fulcrum close to where we're working. It's okay to be using a cross arch fulcrum, especially over in this particular area. So we'll angle the rubber cup to flare at the gingival margin and then interproximally. So we'll put usually about 3 to 4 teeth. We'll put the Profi paste on there. And then we'll put our handpiece on the tooth and slowly press and keep that rubber cup moving at all times. So we'll do interproximal, facial, interproximal, interproximal, facial, interproximal. And then don't forget at all times the handpiece is moving slowly. I just don't have that ability here. Interproximal, facial, or buccal, all the way through and distal. Now when we're working on those very last teeth, what you want to do is take your mirror, hold it back there, and then have the patient close down just a little bit, and then you're allowed to get that handpiece back there a little bit better. Now, the other thing we don't want to forget to do is do the occlusal surfaces. And especially on these molars, we really have 4 cusps. On the premolars, we only have 2. So we'll have the rheostat going slowly here, and then here, and then here, 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 and here. So there's 2 cusps, and then there's 4 cusps coming from the occlusal. So then we'll do buccal lingual, buccal lingual. After we have completed polishing, we will go ahead and floss, and then we'll want to make sure that we keep a little bit of the prophy paste on there when we floss, so that helps kind of get the plaque out interproximally. So we'll use the modified Bass technique to floss throughout the mouth. Then we will go ahead and let the patient rinse, and we will apply the varnish. Now, some offices still just use the fluoride gel, and I've posted a video on the technique for that. This is the video for the varnish. So you pull this off, and you can see right there, that's where the varnish actually is right there. So it's very simple. You're just going to have rinsed, flossed. You'll dry that off. Make sure it's as dry as you can get it. Then you'll just take a little bit there, and you'll paint it on. Just like that. And then don't forget the occlusal surfaces. Okay? Do it on gingival margins. And just keep reapplying. Go throughout the whole mouth. And apply. And that's the technique for coronal polishing and applying varnish.